Hi, this is the CV5 lecture for Physiology of Circulation. Your question is, how do we measure how efficiently blood is pumped through our blood vessels? So see if you can answer this question using these vocabulary by the end of this unit. So when we measure or when we look at the physiology of circulation, we're trying to figure out how efficiently our cardiovascular system is working. And we can measure that using these vital signs. When you go to the doctor's office, the nurse will, take all these measurements, and this is what you'll see on the monitor. So your body temperature is shown right here. Your respiratory rate is shown right there. The arterial pulse would be this number. And your blood pressure is normally shown right here. It's just not on this particular image. And if you're wondering what that 99 is, it's the percent oxygen saturation in your blood. So you want it to be somewhere between like 98 and 100%. The average human body temperature is somewhere between 97 and maybe 99 degrees Fahrenheit. That's your homeostatic range. So this is the first vital sign. If you fall below 97 degrees, you're at risk of hypothermia. And if you go above 104 degrees for children under 4 years old, then they're at risk of febrile seizure, which is febrile meaning fever, and then seizure that can cause lasting damage to the brain. For children 4 years old and older, or for adults, if their fever rises above 107 degrees, then they're at risk of febrile seizure. And so the body temperature is often one of the earliest indicators that something is wrong. The next vital sign that we check for is respiratory rate. So if you are an adult at rest, meaning you're just sitting around not exercising, your respiratory rate should be between 12 and 20 breaths per minute. If it's above 20 breaths, that means that you're short of breath. And that's weird because you haven't been exercising, right? This is your resting breathing rate. So there must be something wrong in your body that's causing you to have to overcompensate for your lack of oxygen by breathing so quickly. If your breathing rate falls below 12, then that's an indication that the mechanisms that control your breathing rate, that there's something wrong there. The next vital sign that we check for is arterial pulse. And so this is where you take two fingers, not your thumb, usually like your index finger and your middle finger, and you just put those fingers at one of these pulse points. So these are places where the blood vessels, the arteries, are right under the skin. And these are also places where the skin is typically really thin. So it's easier to feel the arterial pulse. What happens here is that at each of these pressure points, the left ventricle of your heart is going to push blood out of the aorta, up to your head and neck, out through your arms, to your wrists, and then down through your trunk, down through your leg, out to your feet. And so as the blood passes each of these pressure points, with each systolic contraction, because remember systole means ventricular contraction, unless it's atrial systole. So systole means contraction. So with each contraction of your left ventricle, you're going to have a pressure wave of blood, or a systolic wave, that pushes through the arteries, causing the arterial walls to expand, and then after the blood passes through, they recoil again. And so that's called the arterial pulse. The two most common pulse points are the radial pulse and the carotid pulse. The carotid pulse is because not only is it right under the skin at your neck, but also it's close to where the heart is, right? Because the heart is right here, and then the carotid pressure point is right there, so it's really close. The radial pulse, by contrast, is really far away. So the blood at that point has to travel all the way, across your shoulders, down your arm, to your wrist. And this is another place where the skin is really thin, so it's easy to palpate for the radial pulse. Now, if you have a really efficient heart, you shouldn't have a big difference between the pulse point you take here and the pulse point you take here. But if there is a big difference, that's an indication that your blood is moving really sluggishly through your body. So there's something that's interfering with the ability of your heart to pump blood through all of the parts of your body really well. For example, if you have uncontrolled diabetes, you might have really thick blood, and that means, or you might have too much blood, high blood pressure. And so that means that the blood is actually going to have a harder time getting to all of the parts of your body, which is why people who have uncontrolled diabetes are at greater risk of blindness or of amputation of their fingers and toes, because if the blood is not getting to your eyes, or if it's not getting to your fingers, then those cells are going to die from lack of oxygen and nutrients. And so that's why it's really important to monitor and control diabetic conditions. The pulse rate should be equivalent to your heart rate. If you're a healthy human adult. So for the average adult at rest, the heart rate is somewhere between 60 to 100 beats per minute. But if you're athletic, it's going to be lower than that. And the reason is athletes condition their bodies. They put like such strenuous demands on their body that it forces their heart to feed more oxygen to their muscles. So then that means that the heart now has to pump faster, and it has to become more muscular. That strain causes the heart to become more muscular. So even when these athletes are at rest, because their heart is going to be more muscular and larger than the typical heart, the heart has to pump fewer beats per minute because each beat is going to push more blood through the body. And this is particularly true of runners and swimmers. So they tend to have slower, more efficient hearts. As you get older, your heart also just kind of slows down for a couple of reasons. One is as you grow from a child to an adult, your heart gets larger, so it needs to pump fewer times. But then also as you become more elderly, the heart muscle itself, it just kind of wears down because it's been a while that it's been pumping blood for you. And so for that reason, the maximum predicted healthy heart rate for an adult is estimated by taking 220 minus your age. So if you're 10 years old, a maximum healthy heart rate would be 210 beats per minute. If you're 80 years old, then the maximum healthy heart rate would be 140 beats per minute. So that means 210 beats per minute is healthy for a kid, but it's a really big danger sign for an adult. This graphic is just telling you what is your target heart rate if you're trying to accomplish different goals. So if your goal is to lose weight, you want to hit a heart rate that's somewhere in this yellow band. If you want to get aerobic exercise, you want to hit this green band. And if you want to increase athletic ability, then you want your heart rate to hit this red band. And you'll notice that all of these bands go down as you age, because remember that your heart does wear down as you get older. It should also make sense to you, by the way, that children, especially very small children, have such fast heartbeats. Because if you think about the size of a child's heart versus the size of an adult heart, a child's heart is so small that it's just going to have to beat more often in order to push enough blood out to feed all of the cells of the body, especially because a child is in a growing body. So children have higher energy needs per pound than adults do. So how do you find your pulse or your heart rate? Find your pulse, so 2 fingers at one of the pressure points. And then you just set a timer for 60 seconds and count how many times you can feel that pressure wave through that pulse point. This is even easier. Set a timer for 15 seconds and then count how many beats you feel. And then multiply that number by 4, because 15 times 4 equals 60. So the number of beats you get in 15 seconds will give you your beats per minute. The next vital sign is blood pressure. So this is the pressure that's exerted by your blood flow as the blood passes through large arteries. And so the blood is going to push against the walls of large arteries and put pressure on them. The unit is millimeters of mercury because back in the olden days, we used to take temperature and things like that by using mercury thermometers. And so the pressure would push the liquid mercury up, and it's chemistry. So at any rate, your pressure is going to vary according to the amount of blood that is passing through that part of the artery at any one point in time. And typically you take your blood pressure at the brachial artery. So imagine that this is the artery that's running through your upper arm. As the blood is pushed out of the left ventricle and passes through the brachial artery, then that causes the artery walls to expand, and we call that the systolic blood pressure. So it's the pressure at the peak of ventricular contraction. But then as the atria are filling and the ventricles relax, then that means that you have less blood pushing against the artery walls, and so the artery walls relax. And so that is indicative of the pressure that you get when the ventricles of the heart are relaxing. So this is the diastolic relaxation pressure. So when you take blood pressure, you report the number as two values. The first one is the systolic or maximum blood pressure, and then the second one is the diastolic or minimum blood pressure. And a healthy range is 90 to like 100, more like 120 millimeters mercury for the systolic reading, and then 60 to 79 for the diastolic reading. So, well, 60 to 80. So just think of like 120 over 80 if you're a full-grown adult. That's a decent target. If your blood pressure falls below 90 for systolic and 60 for diastolic, then that means that you probably have hypotension. Now, if it's just one moment in time, it's not a big deal, but if you have a pattern of this over time, that means you have hypotension. And this is often associated with illness or injury. Now, obviously, if there's injury, you know, like you've lost blood, well, if you've gotten into a car accident or something and you've lost blood, then obviously you have lower blood pressure. But let's say that you didn't realize that you were ill, and then you get hypotensive readings. That's a good indicator that there's something wrong. Maybe you're anemic, maybe you are dehydrated, whatever it is. But more common is hypertension. So hypertension is where you could get a systolic reading that's above 120, or a diastolic reading or a diastolic reading that's above 80. And this can be really dangerous if you keep getting hypertensive readings over time. So here in this graphic, actually that's the next slide. In this graphic, we have diastolic pressure shown on the horizontal axis and systolic blood pressure shown on the vertical axis. And these boxes are showing you, for the green one, this is the normal range you want to fall in for systolic and diastolic. But if you are way hypertensive, stage 1 hypertension is an indication that you are at risk of heart disease, and stage 2 hypertension is an indication that you already have heart disease and that you are at high risk of heart attacks or strokes or things like that. So high blood pressure is a sign that the heart and the blood vessels are being overworked. It could be for a couple of different reasons. One is you might just have more blood than a healthy person. So the more blood or the higher blood volume you have, the harder your heart has to work, the greater the pressure through the blood vessels. The other possibility is maybe you have the normal amount of blood, but your blood vessels are not as wide as they should be. And a common reason for that is a condition called atherosclerosis. So atherosclerosis is a disease where plaques, cholesterol, saturated fatty acids, trans fatty acids, those can accumulate and stick together and build up inside of your arteries. And as they do, they narrow that arterial opening, which means now that the artery is narrower, it's putting more pressure because the blood has to squeeze through a narrower blood vessel. Think of like if you have water running through a hose and you narrow the opening of the hose, then the water shoots out harder. So this is an indication that you have heart disease. Your heart is being overworked because it has to push the blood out more or work harder in order to push the blood. And so heart disease can lead to heart failure. And that can happen in the form of heart attacks, where the heart is not able to feed blood to itself because the coronary arteries that feed the heart are blocked. It could also lead to strokes, where the blood vessels that go to your brain are blocked, which would then cause your brain cells to die. Your pressure in your blood vessels does decrease as the distance from the heart decreases. So blood pressure is related not just to where you actually taking the measurement, but also what is the cardiac output? So what's the amount of blood that the heart pumps through the body each minute? Where the larger the heart, the larger the cardiac output. Once again, athletes tend to have a larger cardiac output. But also people who have heart disease may also have a larger cardiac output without also having the musculature of the heart, like a very muscular heart, that would enable the heart to pump that amount of blood out. So this is why it's important to take blood pressure, because it gives you information about all of these things. Here, the aorta is closest to the heart. And then as you go through arteries and arterioles, blood pressure decreases. And then as you go through capillaries and veins and back to the vena cava, the pressure is, of course, the lowest. And at that point, you're going to have to rely on skeletal muscles that surround your veins to literally contract and just push the blood up through your veins. So how do we take blood pressure? You're going to use a sphygmomanometer, also known as a blood pressure cuff, and you're going to use a stethoscope, and you're going to osculate for the blood pressure readings. Osculation means listening, hearing. It comes from the same root as audition or auditory. So this is how you take blood pressure. This is your brachial artery here. And if you inflate the blood pressure cuff, you're basically squeezing the artery so that you're cutting off the blood supply. And then as you release air from the cuff, that allows blood to trickle back in. And because the opening is still narrow, the blood pressure is going to be high as the blood like thunders through the narrow opening to try to rush back into your lower arm. And then eventually, the pressure at which the blood is now able to flow freely, even as the blood pressure cuff may not be fully deflated, that's where you will last hear the heart sounds or the blood pressure sounds. So that first pressure reading that you get as blood begins to trickle back in, that's the systolic pressure. And then that last reading you get, that's the diastolic pressure. And then remember that the systolic pressure corresponds to systole of the ventricles, and diastolic pressure corresponds to diastole or relaxation of the ventricles of the heart. So, this is how you take blood pressure. And if you want to read through this, the slides are in the CB5 folder in Google Drive. And this is a 7-minute video on how to determine a blood pressure reading, so it's a great tutorial. Here you have an interactive website that gives you practice on taking blood pressure readings, although I think it's now behind a paywall, which is why we are not going to do it in class.